Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, February the 8th, 2021. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen De Villa, and Toronto Fire Chief, and the General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, Brad, thank you and good afternoon. Today, the Province of Ontario announced a plan for a gradual reopening over the coming weeks. The fact that we are able to consider a Toronto reopening over the coming weeks is thanks to the vast majority of people who have done the right thing over the last few months. The efforts of individual Torontonians and the sacrifices of businesses are having a positive impact, but we are not there yet. Hence, the extra time the province is rightly requiring before we begin here in the City of Toronto in earnest to begin the reopening process. That time, in Toronto's case, is not yet, though having the elements of a plan is needed and welcome. The number of new cases is going in the right direction. The 7-day rolling average of new cases was 892 a month ago. It stands at 471 today. That's a big improvement. But let's not forget, it stood at 47 last September and was 15 cases a day on a rolling average on August the 1st. So we all need to keep doing the right thing because COVID-19 is still here and the new variants, which can spread faster, are here as well. Our medical experts who have guided us well through uncharted waters, they say these variants are the real thing. And that means great care and caution as we even consider the right time to reopen here in a city of 3 million people. You will hear more about the variants from Dr. De Villa in a moment. Her comments should cause us all, yes, to plan for reopening, but actually to do so with great care. The more we follow well-known public health advice to stay home, keep our distance, keep to ourselves and wear masks, the faster we will be able to reopen and stay open. Our first important priority is to work with the province and the school boards to get our schools open safely starting next week. On that, we all agree. Toronto Public Health is all over that. While we're doing that, we will continue to work within provincial mandates and rely on expert public health advice to get the rest of our city, including smaller businesses, reopened safely when the time comes. I am supportive of an approach which recognizes that Toronto has experienced and continues to experience some more entrenched challenges with COVID-19 and may require some additional time. Our experience with the variants, in respect of which there is also still a long list of unknowns, may also require additional time. I am also supportive of the province's plan, once reopening takes place, insofar as they help address some of the unfairness that has resulted from big businesses being open and not smaller ones. These are things that should be part of the plan when the time comes for reopening. We can't be in lockdown forever, but we have to make sure we do everything possible to have a safe reopening and to try as much as possible to avoid having to ask businesses or schools to close their doors again. That sentiment was shared in a meeting today with the Greater Toronto and Hamilton area mayors and chairs. We all agreed that we should be careful in our reopening so that when places are able to reopen, they're able to stay open. We believe this will be best accomplished through the use of consistent standards, consistently applied based on prevailing local circumstances. The mayors and chairs also stressed once again the need for a safe Restart 2.0 agreement. The reopening in the GTHA will be crucial to the successful restart of Ontario's economy and Canada's economy as a whole when the time comes. This week, I'll be taking part in a number of meetings with federal officials, including the Prime Minister, as part of the National Big City Mayors Caucus, and I will be reiterating the need for the federal and provincial governments to work together in order to come forward with funding for municipalities through a renewed Safe Start agreement. As cities work with their 2021 budgets, the vaccine distribution, and ongoing efforts to fight the pandemic, including the variants, it is absolutely vital that they have the funding commitments necessary to help finance their continued response, particularly in light of the drastic revenue shortfalls once again this year, 2021, in areas such as transit fares. A completed Safe Restart 2.0 agreement will give Toronto and all municipalities the stability they need to support the safe reopening and to focus on a strong economic recovery. In advance of this week's meetings, I have made this point directly in constructive conversations I had with many key federal and provincial leaders. Renewing this agreement early in 2021 will be the best way to make sure municipalities can continue to respond to this unprecedented pandemic and the variants, and continue to make much-needed investments in major capital projects, which create jobs and will help to renew vital infrastructure that will be crucial to any successful economic recovery. I look forward to reporting to you on those meetings and the progress made in those meetings later in the week or early next. Now I would ask Dr. Davila to offer her report for today.
Thank you, Mayor Tory, and good afternoon. Today, I am reporting 421 new cases of COVID-19. 414 people are in hospital and 94 are in the ICU. Sadly, 13 people have died. With regard to data, the transition to the province's system is now largely complete, and we plan to resume full reporting shortly, like later this afternoon. In the short term, there remains the possibility of some adjustments or some updates to data as a result of the transfer, which for the most part has gone very well, given the size and the complexity of this task. Today, we are in a transition from one pandemic to another. A transition to a new pandemic. It was inevitable the variants of concern would emerge in Toronto. The UK variant, B.1.1.7, is confirmed. Screening indicates the South African variant, B.1.351, and the Brazilian variant, P.1, are here too. I take the view that it is important to see the circumstances for what they are. We are in a position of great uncertainty with respect to variants, but what we know is alarming. I understand the value of preparing for the time we can lift restrictions. From a public health perspective in Toronto, that time is not now. Decisions to reopen do not come with guarantees, except that cases of COVID-19 will rise when we interact again more frequently. We've seen this before. There's no reason to believe it will be different this time. In fact, there's probably less. If, as expected, variants of concern become the dominant strain in Toronto, there is an even greater likelihood of case counts increasing, given increased transmissibility is proven by science to be true. Last week, I spoke to projections about COVID-19 deaths if transmission increased going forward. Here is a more detailed look at that in work provided by the Centre for Disease Modelling at York University. The model examines the levels of death at various levels of virus transmission. It is based on transmission rates as seen in Toronto in mid to late January. On that basis, according to the model, with unchanged transmission rates, the death toll for Toronto would rise to almost 5,500 by this May. If transmission increased by 10%, the model finds Toronto's death toll would rise to slightly more than 9,200 fatalities. If transmission increases by 20%, we would expect 15,865 deaths by May of this year. So far in the pandemic, we've seen a little more than 2,500 deaths in total. Rising cases is an inevitable consequence of mixing, particularly if we do not take steps to protect ourselves from the spread of the virus. Recall that at Thanksgiving and Christmas last year, we saw corresponding rises in case counts afterwards. Illness, strain on the healthcare system, strain on healthcare workers, strain on the economy. There is also the return to school to consider in this context, which is now a little more than a week away. So we will face a real challenge when presented with the opportunity to move about again with reduced restrictions, but without more protection from COVID-19. Add to that the real chance there is actually greater risk of infections because the variants of concern make COVID-19 even easier to catch and easier to spread. COVID-19 and its mutant variations are out there, seeking a host through which to live and through which to spread to the next person and the next person and the next. There is always a lot under our control as individuals. One of these things is understanding and accepting realities. The threat of COVID-19 has not gone away, and unfortunately, a lifting of the restrictions will not make it go away. With that, I'll now turn it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila, and good afternoon. Our coordinated enforcement teams continue to work diligently to enforce the regulations relating to COVID-19. The City has taken formal enforcement action more than 2,100 times to date. This weekend, our enforcement officers continued to monitor compliance with the Reopening Ontario Act. As a result, 3 charges were laid against the owner and operator of a cosmetic store. Our officers also proactively inspected 236 bars and restaurants, with no violations being observed and no enforcement action being required. Over the course of the weekend, our enforcement teams responded to 122 complaints relating to large gatherings on private property and in private residences. Following response and investigation by our municipal law enforcement officers and Toronto police officers, 37 charges were laid. This weekend, Toronto Police also responded to a number of protests, resulting in 6 charges being laid under the Emergency Management and Civil Protection Act, and a further 6 charges being laid under the Criminal Code. I would like to extend my thanks to each of our enforcement officers who do their best to meet the challenges associated with COVID-19 regulations each day. Finally, we are aware of a small number of businesses that have indicated their intent to open this Thursday in contravention of the provincial orders requiring them to remain closed. The City's integrated enforcement team, including municipal licensing and standards, Toronto Public Health, and Toronto police officers, are actively monitoring this situation and are prepared to respond as required. We will take appropriate enforcement action against any business that operates in contravention of the regulations governing the operation of non-essential businesses, as we have done throughout the pandemic. We know that the vast majority of businesses and residents continue to do the right thing in support of our collective public health. By complying with the public health regulations, we save lives and protect the capacity of our healthcare system. Finally, I remind everyone that toronto.ca/COVID-19 is the best and most reliable source of information relating to COVID-19 in Toronto. Thank you.
Thank you very much, Chief. Just a reminder to reporters to please unmute yourself before asking a question. We also have a number of senior staff on the line should you have detailed questions, including the Toronto Police Service. We'll go first to Matt Bingley from Global News. Go ahead, Matt.
Hi, good afternoon. Dr. Davila, just speaking about your concerns about variants of concern, assuming that Toronto does get into the gray zone, I guess it would be, in a couple of weeks, that would allow for more people within grocery stores, supermarkets, and I'm wondering if you think that's a good idea for Toronto based on what you're seeing with how these VOCs are spreading.
So, Matt, as I've indicated in my remarks, I don't believe that now is the time for us in Toronto, given our circumstances, to relax public health measures. I think we need to be very concerned around that which we're seeing with COVID-19's variants, particularly given what we're learning from what has happened in other jurisdictions. I do think that things do change very quickly when it comes to COVID, and I think we need to monitor very, very carefully and observe what we're seeing on the ground and make the best decisions, applying the best available evidence, the best available science, in order to act in a fashion that is consistent with the best interests of the people of Toronto, given that we are in the midst of a pandemic and that we have to concern ourselves with what influences and impacts on public health.
So to follow up on that, do you look at that timetable of February 22nd as being too early for, allowing 25% capacity in retail stores?
Matt, I think it's difficult to talk about particular timelines, and I would encourage people not to look necessarily at certain timelines. We know that what we want to see is ongoing reduced transmission of virus, and we'd like to see that as low as possible. I think that when we look at the experiences of other jurisdictions that have been a little ahead of us in respect of dealing with variants of concern and having variants of concern within their environments, my understanding is that they've said, extra caution is absolutely needed, given that the measures do have impact, but just given that increased transmissibility associated with many of these variants, the issue is that you have to really be extra vigilant around self-protection measures and public health measures in order to continue to reduce the transmission and the spread of virus in the community.
Thank you. We'll go next to Mark Douglas from 680 News. Mark, go ahead, please.
Thanks, Ross. Dr. Davila, just to follow up a little bit and expand perhaps a bit on Matt's question there, if the variants, as you say, are going to constitute some kind of whole new kind of pandemic, should we even be tossing around any dates for starting to reopen?
So, as I indicated in my remarks, I think that we need to think about reopening, and I think it's a wise thing, and I think it's understandable to speak of reopening, to plan for it, because that day will come. And it's best to have lots of opportunity to review what safer reopening looks like in the context of a pandemic. We are, however, as I indicated, approaching a new pandemic, transitioning to a different phase and to a new pandemic altogether. And we know that the experience in other jurisdictions tells us that extra caution needs to be applied. But that being said, I think that it's quite reasonable and quite understandable for us to engage in good conversation and to start planning what safer reopening looks like, such that when that time arrives, we're better prepared and better able to implement in a very thoughtful and coherent fashion.
Thank you. And for a follow-up to both yourself, Dr. Davila, and to you, Mayor Tory, the Premier and the Cabinet spoke today about their emergency brake that they'd be ready to pull if the COVID numbers go the wrong way during the reopening plans. I'd like to know if the City of Toronto has its own kind of emergency brake that you could pull independent of any action that the province might want to take or avoid taking.
Well, why don't I start off and then I'll let the mayor speak to that. I don't know, and I can't predict exactly what will happen, and therefore I can't really predict with any certainty what particular actions might be taken or should be taken in the future. I can say that as far as I'm concerned, my responsibility to the people of Toronto is to ensure that I'm providing the best possible public health advice and that I'm applying the best available science and evidence to act in a fashion that's consistent with the best interests of the health of Torontonians. That's what I've sought to do throughout the pandemic, and I think the people of Toronto can count on me to do that on an ongoing basis.
I will just respond to that question by saying this. We live in a province. We who live in the City of Toronto live within a province. We live within a region. And so the realities are, as we've said throughout, that the best kinds of measures that are taken that are going to be the most effective overall, given that people move around, are measures that are taken regionally or provincially. I will say, secondly, that the powers that we have, both as a city government and our medical office of health, are limited, the legislative powers. And so I will just say that the circumstances, as has been the case throughout, will dictate how we make use of those powers, how we ask for different measures to be undertaken by the province based on the advice of our medical officer of health. And we will not hesitate to do anything that protects public health. And so I think we are wise to be planning for reopening. We are, I think in our case, we are encouraged by the fact that extra time has been given here, in particular in the City of Toronto. And I think you take these things day by day based on a lot of unknowns that are out there with things like the variants, and rely on the expert advice that we have available to us.
All right, thank you. We'll go next to Trevor Dunn from CBC News. Trevor, go ahead, please.
Thank you, Brad. Dr. Davila, I'm struck by this term you use, new pandemic, that we're transitioning to. It's still unclear in Toronto where we're going in terms of reopening the economy. We do have a firm date on the return to school. So what is your message to the thousands and thousands of families sending their children back to school in Toronto next week at the same time that we're entering, as you say, a new pandemic?
So, Trevor, I wish I could tell you that I was the clever person that came up with the notion or the concept of a new pandemic. Unfortunately, I can't take credit for that. I would say that there have been other public health authorities and individuals who have used that term to describe the emergence of the new variants of concern. And we are not the first jurisdiction to have experience with those variants of concern. But in every other situation where variants of concern have emerged, that transition from the old variants to the new ones, from the old pandemic to the new one, has been observed. So I can't imagine that we would be all that different. I see no reason why we would be. With respect to school reopening, this is something that I think has been very carefully considered by a number of public health authorities and child health authorities as well. And I do think that on balance, and based on our own experience and the experiences that we've seen in other jurisdictions, that there is a way to provide our children the best benefits, the benefits that can be obtained through in-person learning. There are so many health benefits associated with that. And I do believe that there is a way to run our schools in a way that allows for our children to have all those benefits of in-person learning, while at the same time provides for, a safer environment, as safe as possible an environment in the era of COVID-19 and in the midst of the pandemic. We've learned a lot from our experiences in the fall. All those lessons learned will continue to be, implemented as we move forward. And of course, as with everything, we monitor very carefully and make decisions based on what we see at the time, in keeping with the best available science, and also with the idea that what we're trying to do is act in the best interests of the population, whether we're talking about students, their families, or beyond.
Okay, thank you. And a question now about the infection rate and new case numbers we're seeing with respect to the new variants. Some more encouraging trends we're seeing today in terms of new infections. But the variants are already here, are they not? It's been a few weeks now that we've had B117, and the South African variant case that you found, that was no travel history, so it's community spread maybe in the community. If the new variants are already here, why are we seeing this downward trend in cases when they're so much more transmissible?
So, what we have seen in the experiences of other jurisdictions is that, while you do see some impact with respect to, the original variant through public health measures, that there is a little bit of a delay in respect of what we will see on case increases associated with variants of concern, particularly with relaxed or reduced self-protection or public health measures. It does take some time before the real impact, the full impact of new variants of concern are really felt in a particular environment. That's been the experience in every other jurisdiction thus far where these variants of concern have emerged and become the dominant strain. And my sense is that we should expect that our experience should line up with that which we see in other places.
Thank you. We'll go next to Mark McAllister from City News. Mark?
Thank you very much. Dr. Davila, just to further everything that my colleagues have excuse me, asked you to this point, we've gone through 2 phases now of different forms of lockdowns and reopenings, and now that we're at this phase where the province is slowly going to be reopening things again, and in the same breath you're saying new pandemic variants that are going to cause more problems. Are you worried that we're going back and forth a little too much, and perhaps we're going to end up locking down yet one more time, if not more?
So, Mark, within the context of the COVID-19 pandemic, new or old, right, I've always been concerned. That's my job. My job is to be concerned around what we can do, what advice we can provide, and how best we can protect the health of the residents of this city. I think that when we look at our experience thus far and the experiences of other jurisdictions, the general learning is that we need to be relatively early on with public health measures, and we need to be vigilant around maintaining distance as much as possible. The one thing that has been consistent throughout is that distance, distance, and distance is our greatest weapon right now against transmission and spread of the virus, and hopefully soon that will be accompanied by vaccine. So, the combination of those 2 tools in our toolkit, I think, offer us some hope for the go forward. But in the meantime, I would suggest that it's best, particularly for Toronto at this time, to continue in its current state, as difficult as it is. Just given what we understand of our circumstances, I'm very buoyed by the fact that we have declining case counts and that we have seen improvements in our indicators and numbers. But now is not the time to relax. It is continued vigilance that's required in order to bring those numbers down, particularly in light of variants of concern and what we understand of how they can change the picture in relatively a short period of time.
My second question is with regard to outbreaks in workplaces. Last week there were some stories about the Well construction site and an outbreak of sorts there, although it wasn't necessarily deemed an outbreak by public health at first. So first part of my question would be, how would you define an outbreak? And we've asked this probably a few times of you through the course of this. And secondly, there was some indication that perhaps you would be identifying the workplaces even more so than you are now as a result of this. Is that correct?
So, Mark, that's correct. With respect to outbreaks, generally we're looking at 2 or more cases with a link to a specific space. And in this case, you're talking about a workplace. It's not entirely clear to me that we hadn't defined. I don't think that that's the case. We had characterized that which was happening, things that are 2 or more cases with a clear link to the workplace as a workplace outbreak. That's our standard definition and process when it comes to investigating those situations. As for workplace reporting, the Board of Health did ask us, as Toronto Public Health, to provide a more fulsome list of workplace outbreak reporting in the context of COVID-19, in the spirit of transparency, and to inform the public of that which is happening within workplace settings throughout the city. Clearly, we are moving forward with that. However, one caveat to that is that we do need to make sure that this is being done in a fashion that does protect the confidentiality of personal health information and that prevents the identification of individuals who may be involved as cases within those outbreaks. So it does limit it to organizations of 20 or more employees, so as to provide for that privacy for individuals who may be involved in those work settings.
Thank you. We'll go next to Francine Copen from the Toronto Star. Francine, go ahead, please.
Good afternoon. My question is for Dr. Davila. Dr. Davila, I'm looking at some of the statements that you've made this afternoon, the modeling that shows that if there's an increase in the rate and the number of people who become infected, the number of deaths could rise to as many as 15,865 by May. Your message to distance, and now is not the time to relax. How do you square that with schools reopening next week? I think a lot of people are going to have trouble with that.
So, Francine, I think when it comes to schools, what I've tried to make very clear is that there are significant benefits associated with in-person learning for our kids. And we do need to think about, all aspects of health. Yes, COVID-19 is part of that, but there are significant health benefits outside of, that have nothing to do with infectious disease that are conferred to our children when they are able to partake in learning in an in-person fashion. I would also say this, our experience has been, and the experience of other jurisdictions as well, that the more we are able to control spread within the community, the more successful we are in terms of reducing transmission and spread of COVID-19 within the context of schools. Our own experience in the fall bore that out, and I think that we are really very actively engaged. I know that we are very actively engaged with our school partners to make sure that we are doing the very best we can all together to reduce the likelihood of COVID-19 within the schools and therefore reduce the spread of COVID-19 within schools. There are a number of lessons we learned over the course of the fall. There are lessons we've gleaned from other jurisdictions, and all of these are being applied so that we can maximize the benefits of in-person learning while at the same time providing as safe an environment as is possible for students and staff within the school.
Thank you, Dr. Davila. My next question is for Chief Pegg. Chief Pegg, I wondered if you could update us on how the vaccination program is going in Toronto, and in particular the site that was opened and had to be closed because of a lack of a vaccine supply. Where does all that stand right now?
Thanks, Francine. The planning is very much ongoing and literally is ongoing 7 days a week. As you know, and we all know from the updates from the province, we're still in a situation or in a position where there is not sufficient vaccine available in order for us to be able to reopen the Metro Toronto Convention Centre or to expand into other clinic operations. So at this point in time, we are awaiting via the province. It is the provincial responsibility to provide us with those vaccines. So we are awaiting the point in time where vaccine is made available to us. Having said that, very much ongoing from a planning perspective and a logistics perspective. And it's important to note more than planning. Obviously, we do have robust plans, but these plans are being put into action in order to ensure, like our commitment has been from the start, that we are absolutely ready to go without any delay at the point where vaccine can be made available to us. So those operations are going well. Of course, it's not the news that we want every time that we're told that the vaccine supply is limited. Of course, I speak to General Hillier every day. I know that the province and the General want nothing more than to make vaccines available to us, and I have every confidence they will the very minute they get them. But until such time as that happens, we'll continue to plan, we'll continue to build out our mass immunization plans and through our immunization task force to make sure that we are ready to go, as I said, without any delay as soon as vaccine is available.
Thank you very much. We'll go next to Dave Ryder from the Toronto Star. Dave, go ahead, please.
Hi there. A non-COVID question for Mayor Tory. Mayor Tory, the Auditor General today released an updated report on city tree services and crews that found the problems identified in 2019 where more than half the workday of the city and contracted crews were spent actually tending trees. What's your reaction to the report?
Well, when you have a follow-up to an audit, it's supposed to get better and not get worse or stay the same. And the auditor noted in her follow-up report that there had been some improvements on some of these GPS-related things, but still found, lots of evidence, far too much evidence of kind of old work habits and old work practices dying hard. And the fact of the matter is that we have to take some of these long-standing work practices, I don't know how they got developed or who thought it was right, and get rid of them, so that we can have a focus on the taxpayers' money and on effective use of those scarce resources. So I'm not happy with this. I'm very unhappy with it, and I think there's going to have to be much more change, and I plan to involve myself as appropriate to make sure that change actually takes place, because the Auditor General is just doing her job, and I thank her for that, but this is not acceptable, and more change has to happen, and it's got to happen sooner, like how about yesterday?
And a follow-up on the same topic. Scathing Auditor General reports in the past have triggered the replacement of senior city staff. Is that warranted in this case?
Well, you have to be very careful when you talk about personnel-related matters, both because it is something that is within the direct purview of the city manager and not elected officials, and you have to be, careful that you're making sure you have the right kind of response to findings like this. This situation is not getting better. It got a tiny bit better, but it needed to get a lot better. Old work practices and old habits that may have become entrenched over decades seem to be still entrenched. And so we're going to have to figure out, what remedy is appropriate to make that change happen. And any remedy that will help make this change happen so we can look the citizens of Toronto in the eye and say that these kinds of work practices that don't involve good value for money have been eliminated would be something that I would look at, and we'll take it from there.
Thank you. Final question is to Denise Peglinawan from the Canadian Press. Go ahead, Denise.
Hi, my question is for Dr. Davila and maybe Mayor Tory. My colleague is asking if you can clarify, Dr. Davila, that you're saying that as of right now, Toronto won't be ready to reopen on February 22?
So Denise, what I'm saying is that right now, at this moment in time, reopening is not what I would recommend for the City of Toronto. I think we need to continue our efforts to reduce virus spread. We still are seeing COVID-19 spread and transmission as evidenced by our case rates. I would tell you that we are understandably concerned with the emergence of variants of concern. And the reason why we are concerned about these is because they have been reported to have increased transmissibility. So with the presence of variants of concern in our community, we can anticipate what has been seen in other jurisdictions, and that's an increase in COVID-19 as a result of the introduction of those variants of concern, particularly if public health measures are not either maintained and in some cases strengthened.
Thank you.
May I just comment on that to say the following? It has been my experience so far that Premier Ford and his government have been quite responsive and have paid attention to the particular concerns expressed through our Medical Officer of Health and through me as Mayor to the particular circumstances in which Toronto finds itself. The good news out of what was announced today is that Toronto doesn't have to open today or tomorrow. that there is some time that has been given to take account of the fact that we had what I called earlier on some entrenched challenges that have stretching back some time now with COVID-19. And it gives us some time as well to see what happens with regard to the variants. And I'm confident that if things are not where they should be as we arrive at any particular date going forward, that the Premier, as he has, will take that into account and do what is best for public health. Because after all, I mean, if this city isn't healthy, then its economy, it can't be healthy, its people can't be healthy, its students can't be healthy, the city itself won't be healthy. And I know that he doesn't want that. I certainly don't. The medical officer of health doesn't. So it'll be our job to watch what's going on and watch all these developments very carefully and give him the best advice that we can, which I think we've both been trying to do throughout this entire experience.
Thank you. And as a follow-up for Dr. Davila, are you planning to continue asymptomatic testing for schools when they open?
So Denise, what we have done with our testing partners in the context of Toronto schools is to use expanded testing as something that supports our investigations, whether it's in respect of outbreaks in schools or cases where we need further information to understand where might this person have acquired their COVID-19 infection, or when there appears to be a lot of COVID-19 within a particular school community. We have found that that actually gives us the most value and the most benefit in terms of the resources that are put into it, and actually helps us direct our investigation and direct actions in a way that best protects the health of students and staff within a particular school community.
Okay, thank you very much for joining us. That concludes today's briefing. We will return here this Wednesday, February the 10th at 2 p.m. Stay well.